Hi there. So have you been told that you've got a problem with the disc in your lower back and you're not even sure what that means? Well, my name's Karen Finnin. I'm a physiotherapist and the director of online.physio, and I'm here to explain to you all about the discs in your back in simple terms without all those big scary words. So our spine is made up of a series of blocks of bone, and they're called vertebrae. And the bottom 5 of those make up our lower back, as George is clearly showing us here. Now, in between all of those vertebrae, you can see in light brown here, these are the discs. So where bones are hard and rigid, discs are a little soft and cushiony and squishy. And that's what allows our vertebral column to absorb shock and to also bend and flex and move. So let's have a look at the anatomy of a disc a little more closely. Okay, so as we saw on George here, the discs sit between 2 vertebral bodies. So if they're the vertebra, then the disc sits in the middle. Now the disc is actually made up of rings and rings and rings of fibrous tissue, and there's a pocket of jelly that sits right in the middle of it. So if we have a bit of more of a bird's eye view of the disc, it looks a bit like this. So this would be the front of the body and your abdominal contents here, and this would be the back of your body with your spinal cord here. Now it's rings and rings, concentric rings of fibrous tissue and a pocket of jelly-like substance in the middle. So when we're upright and straight, the spine can absorb shock. But when we bend forwards and backwards, we see something interesting happen with the jelly in the center of the disc. Let me explain. So when you bend forwards, one vertebra bends forward on the next. If this is the front and this is the back. So what happens is the disc gets compressed at the front, and this sends that jelly nucleus towards the back of the disc, okay? And if we bend backwards, it's the opposite. But unfortunately, a lot of what we do is flex these days. We sit, we bend, we lift, we eat. A lot of it is bent forwards. Very little of our natural movement takes us back the other way. So what you have then is a lot of time spent where the jelly nucleus is pushing onto the back wall of the disc, as in this picture here. Now, over time, this can create little fissures or little tears in the back wall of the disc, okay? Because the jelly keeps pushing backwards onto the back wall. Now, you can be developing this little bit of damage without having any pain at all, because the nerve supply is only to the very outer rim of the disc. So this can be building up without you even knowing it, until a day where maybe something even seemingly cryptic happens, like bending over to pick up a pen, and that is the day when the disc swells a little bit because the contents of the nucleus keep pushing backwards, pushing into these tears, and they've finally created some swelling in the back of your disc. Okay, that is the day where you start to feel pain, and sometimes it's a very sudden onset of pain. So when that happens, our brain registers that there's something wrong. It sends a signal to our brain, and that is often to spasm all the muscles and hold it because something's wrong and we don't know quite what's going on, but we don't want you to move. That's our body's primitive defense to there suddenly being pain in that area. Now, when we break it down and we want to get someone going and moving again, there's certain things that we need to do to help the disc to recover, and your health professional will guide you through those. But it basically revolves around asking, how can we get this jelly moving back away from the back wall of the disc to give it a chance to settle down? In general terms, what that means is it's a lot of flexed activity and bending forwards that has caused the jelly to injure the back wall of the disc. So if we can bend back the other way, that's often a great way to help it to settle down. Medication can help with advice from your health professional or pharmacist. Exercises can certainly help from your health professional. And overall, movement and activity is the right thing to get going within the limits of your pain. So I hope that's helped to explain the mechanics of the disc in your back. When this back wall of your disc does sort of swell, it can sometimes show up on imaging or a scan and be called a disc bulge. So that is where that terminology comes from. In extreme circumstances, that bulge gets big enough to press on a nerve. If this is your spinal cord here and there's nerves exiting here, if that swelling gets big enough and encroaches on that nerve, that's sort of a new level of injury. That's why we often ask about symptoms in your leg, pins and needles, weakness. If that's the case, that's obviously something that we really have to take note of and tread very carefully. But in the majority of people, it's just a minor bit of swelling that will settle with the right things. So follow your health professional's advice and you'll be feeling better in no time. I hope that's helped you to understand a little bit more about the discs in your lower back. I'll see you next time.